there's a lot of subconscious things going on in our body. Clinical hypnosis is one of the ways that we can directly access our subconscious. We can go into a state of mind, which is called a trance. And, for people who haven't heard anything about clinical hypnosis, let me tell you, it's very different than stage hypnosis. It's not entertainment. We are not going to ask you to stand up on the table and quack like a duck. We're not going to ask you for your pen on anything. When you're in a trance, you're completely in control of your body and your responses, but you access the state of mind called a trance where that conscious mind that's and running interference and trying to look at things through logic, it settles down because we're able to calm the mind through the trance.
I'm excited that we're going to talk about this subject. Most of my listeners know that my dissertation was actually looking at IBS in women and the intersection of hormones and the microbiome. But I think there's so much that we're going to cover today that doesn't get its due justice, particularly around women's health, digestive stuff, and even the transition, perimenopause and menopause. And so I'm super excited to talk to you today.
Thank you. I'm glad to be here, and it's fascinating to hear about your research, your project. That's awesome.
Yeah.
They overlap.
Yeah, so much. So I'd love to know, so obviously you've got your psychology background. How did you get into this in particular? This arena, the gut, the gut brain access and all of
Yeah.
those pieces. I'd love to hear that.
It was definitely not planned, I'll say that. I I had trained in health psychology. I believe psychology is health psychology, where we look at the whole body and the way the mind is playing a role in all of it. So I come from that lens already. And then in collaboration with a colleague, actually, I was office sharing with my now co-founder of GI Psychology, and we were case consulting, and he was sharing some of his successes with patients. So he was seeing how CBT and clinical hypnosis were rapidly creating relief for people who had had GI conditions, GI distress for decades. That caught my attention. When you see a treatment working that powerfully, I started paying attention. And even though I didn't know what hypnosis was, so I was very skeptical at the beginning and a little suspicious.
Yeah.
um, After learning a bit more about it and seeing how effective the treatments were, and then that really there were so few trained clinicians, I thought, okay, this is my path. This is where I want to do my work because there's such great potential for, a really large impact.
Yeah, you're so right. It's interesting because I talk about this a lot with our clients and patients at my companies, but and even have done some podcasts on, a lot of people just very simply if they're thinking, well, why would I use hypnosis or cognitive behavior therapy to work on a gut thing? Just taking something that completely from a different lens, right? So if it's trying to make dietary and lifestyle changes, most people think that our decision making is under a logical, frontal lobe decision making. I'm like, no, 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 that's top down, i.e., brain thinking about it. But the reality is most of our decisions are made subconsciously, right? Subconsciously, which is oftentimes what we call bottom up, right? It's stuff that we don't control. And then the other part of it is our microbiome communicates through that, and we have this connection. And so that not only translates to how we make decisions about foods or this or what are we doing,
Mm.
but those same interactions translate to physical sensations and symptoms because your logical brain is not in control of the system.
Exactly. There's too many automatic processes that our body is equipped to make, and then you add our subconscious. There's a lot of things going on that are not logical. So if we only look at it through the logic lens, things won't make sense and we'll fall into that trap that many do of looking for the answers and thinking we still haven't found the answer. Well, the answer doesn't have to be, some structural abnormality in your body. The answer can be this miscommunication that's happening.
Yeah, so let's dispel some myths. So because you mentioned the word hypnosis, and so I'm sure people are thinking about the hypnosis that they see on some stage and making people cluck like a chicken, which I have witnessed before. But there's an application of cognitive behavior therapy and CBT and hypnosis. I'd love for you to define those for everybody so they understand that they have a actual structure and function.
Mhm, sure. The nice part is cognitive behavioral therapy has so much scientific support. It's one of the most evidence-based psychological treatments out there, if not the. And so gut-directed CBT, cognitive behavioral therapy, is just looking at it through the gut lens of, one, understanding the body, the physical nature, the way in which it's connected to various systems, and having a therapist that understands that and knows it from the get-go. But then there's also educating on, well, what types of maladaptive thoughts related to the GI distress could be showing up? Or what type of avoidance pattern? What type of behaviors are you engaged in that might be either magnifying the symptoms and distress or potentially even maintaining it? So, just like with regular CBT, looking at the cognitions, the behaviors, we do the same thing, but from a very gut directed lens. And then with cognitive or with gut directed hypnosis, you know, this can be, it has a bit of twofold, in my opinion. One, one realm of it is that it amplifies the effects of CBT because, as you were saying earlier, there's a lot of subconscious things going on in our body. Clinical hypnosis is one of the ways that we can directly access our subconscious. We can go into a state of mind, which is called a trance. And, for people who haven't heard anything about clinical hypnosis, let me tell you, it's very different than stage hypnosis. It's not entertainment. We are not going to ask you to stand up on the table and quack like a duck. We're not going to ask you for your pen on anything. When you're in a trance, you're completely in control of your body and your responses, but you access the state of mind called a trance where that conscious mind that's do-do-do-do-do-do-do-do-do-do-do, and running interference and trying to look at things through logic, it settles down because we're able to calm the mind through the trance. And then we also can access that subconscious pathway to where our body's natural healing can be accessed. So, in gut directed hypnosis, we can magnify the CBT, but we can also incorporate what's called positive suggestions to almost remind the body that it knows how to heal itself. Hypnosis has been shown also 40 years of research shown that it can impact physical health. We're talking about hot flashes. Yay.
Right.
We're talking about even inflammation or blood flow, pain, blood pressure. A lot of things can be influenced through clinical hypnosis. So that's the combination that we use, not just one or the other, but blending them together.
Yeah, I think it's so fascinating. I've gone through a little bit of hypnosis, and I think, clinical hypnosis, I'd actually, you might not find that shocking, but I don't go into a trance state very well. Like,
Okay.
some
Yeah.
people's logical
You and I
brains is
are
like,
opposites. I go into it really easily. I didn't
yeah,
know
I have a
that.
friend of mine that, like, all they gotta do is start, and she's, like, already there, like, because my
Yeah.
because she just immediately. And but I've been through clinical hypnosis, and I think a lot of people are worried, yes, that they're not gonna be aware of what's going on. And it's like, no, you're absolutely aware, but you're also open to suggestion, which allows you to create a new reality for your nervous system. And I think that's the part that people need to understand is you're creating a new reality to let your system sort of rebalance itself.
Mhm. And
So obviously you got into hypnosis and cognitive behavior therapy out of digestive stuff. Did you go through some of that yourself? Because I think a lot of us often do.
yes, and it was a little bit in reverse order. I had already decided to co-found GI Psychology, and it sounded like a wonderful adventure and challenge and community need. And, around the same time I delivered my second child, my husband retired from the military, we moved. There's all these stressors and events and excitement. But there was also some structural kind of trauma after the delivery, and it instigated IBS for me, in addition to antibiotic use. I mean, I think it was like a perfect storm situation going on in my body. And so I experienced the journey that many of my patients do, where I was looking for the answer. It
Yeah.
didn't make sense. I knew there was something still happening in my body, and I knew of IBS really well. It was one of my favorite things to treat, and yet it didn't click for a while. In fact, I needed to go visit the GI gastroenterologist, and within 5 minutes, was like, "Oh, you have IBS." I didn't receive education or, suggestions on what I could do, but just a diagnosis and a script. and thought, oh, this is what everyone's going through. Wow. I knew it intellectually before, but it was an emotional awakening of, oh, I get it. Like how
Yeah.
helpless this can feel. So, although I had already decided to launch GI psychology, that really sealed the deal for me of I want to be part of the change so people don't have to keep getting the shrug shoulders or roundabout answers.
Yeah, it's interesting 'cause, I think we were talking earlier in my dissertation literally looked at IBS in women and our hormones, right? So and the microbiome, sort of all those things mixed together. And the reality is we came up with that terminology in the late 1800s. And today we still have and IBS is a blanket statement for we have no effing idea, right? From a medical community standpoint, there's no treatment that works specifically, right? No one treatment. We don't have a true like we have different reasons why people might get it. Like, Pimental's work shows that it might be from, kind of an over the top immune reaction to a viral infection like a stomach bug.
Mhm.
And then you've got SIBO and you've got all these different things, but the reality is the symptoms show up and for whatever many triggers there may be, but there's a part that has nothing to do with dysbiosis, bacterial imbalance or infection. And it really is this gut brain connection and how the nervous system is so connected to the gut and you can't separate those, right? I'd
Yeah.
love to go into a little bit about your perception of the gut brain balance and those interactions. Because I think that gets completely missed. I mean, as somebody who has a lot of history, 20 years of working with digestive stuff for women, but also you look online and it sounds like, "Oh, you just need to take this herb or you just need this antibiotic regimen," and then, like, something magical happens, but that's not what people experience at all.
If magic existed for this problem, please tell me someone would have pulled out their trick by now. Like, the magic does not exist. It's we are a very complex system, so it makes sense that there's so many different pieces to the overall system that are communicating, interacting, amplifying, or interfering, and so, yeah, there can be a variety of triggering events. Oftentimes, what we'll see is regardless of the triggering event, and sadly, regardless of how many attempted treatments they've tried, a lot of times there's still the reminiscence of something else is still happening here, right? Why isn't the change in my physical activity and nutrition, why isn't it changing it? Why, when I had my workup, there wasn't anything clear that was shown that's still going on. That oftentimes points to two things. One, visceral hypersensitivity, and then hypervigilance in the gut. So even after the original triggering event may potentially have been resolved, there's a high likelihood that these two are still playing out. And both of those impact the bidirectional communication. So, visceral hypersensitivity, right? I imagine you've talked about this before. Hopefully the listeners have heard it, and it's good for the repetition. This is when, our body is experiencing typical sensations, typical movements or processes, but the way in which the body is experiencing it is almost like the amplifier is turned all the way up. So, one example I'll share with my patients is, if in the past, prior to developing this unhelpful communication between the gut and the brain, maybe a gas sensation would have been a 3 out of 10. Obviously, it can vary. It can be a 7 or 3 or 1, whatever. But in this scenario, it's a 3. Once you've developed visceral hypersensitivity, that exact same movement and experience now can feel like an 8, a 9. Of course, the person's going to be experiencing pain and start to feel anxiety about the pain, maybe even avoidance and start to restrict food and other activities, right? So, visceral hypersensitivity can be real, impact to someone's functioning.
Yeah.
And then the other one, hypervigilance. So similar to with trauma, hypervigilance is where the body is chronically scanning for danger. And that's part of our primitive wiring. This is a good thing that our body is scanning for danger in general. But what can happen when that communication pattern goes awry is the hypervigilance starts to take over. It's chronically scanning for danger. And just like if you're chronically looking for anything, right? If there's that person in class that's always tapping their pencil and then you show up for class, you're going to be scanning. Are they tapping? Are they tapping? And that's what our body's doing. It's looking for danger signals. But if it's chronically looking, it's gonna pick up on a lot more than it normally would. And so we can teach, patients learn how to catch these things and then how to start to the phrase retrain your brain. And that's CBT and hypnosis do both of, they retrain your brain.
Yeah, because I think this is a very, overlooked part of the treatment of IBS and digestive disorders as a whole. Because at the end of the day, regardless of what happens, you're gonna have at least hypersensitivity, right? If you went through a period of gas pains and bloating and constipation and or diarrhea, your nervous system is going to be turned up to those things. I tell people all the
Mhm.
time, like, what's happening in here is you should have very little awareness of, right? At the most part,
Yeah.
these organs are moving. There's a lot of movement happening. The stomach's churning, the intestines are moving and contracting, and all those things. And for the most part, a well-oiled, well-balanced machine, you don't really recognize it, But
Yeah.
but that hypervigilance and then the sensitivity means that everything gets amplified.
And
You
then it
know?
it it continues to spiral and build on each other. I've even, something that I experienced is once I had had the intense pain, for months, even when it started to feel better, I started to change behaviors and feel like my body was being nicer to myself. I still, the moment I would have a pain signal, or the moment I was preparing for a road trip, now that anticipatory anxiety, that worry, those memories of the pain would pop in. So now I'm activating my stress response system, my hormones, my neurotransmitters, my cortisol. All these things are now potentially being involved, which also impact your GI tract. So even if there wasn't anything happening in the stomach originally, those worries and anticipatory fears have now activated, GI systems, potentially creating the pain that wasn't gonna happen in the first place.
Right, right. Yeah, because you're right. Because adrenaline and, epinephrine, norepinephrine, dopamine, your hormones, they all have receptors in the gut. They're all there. They're part of the function of the gut. So if you are worried, like a lot of times what I hear clinically, and I know my clinicians here, and I'm sure you do too, is somebody with the history of IBS or any digestive disorder, if they're getting ready to take a road trip or fly, they automatically start to worry 3 or 4 days beforehand about what's gonna happen while that activity happens, right? Which means that their nervous system is amplifying over and over and over again at the worry of the thing that hasn't even happened yet,
Yeah,
you know?
exactly.
And it's almost like a self-fulfilling prophecy. You're gonna have all this nervous system activity that's then gonna activate the gut, and we might have some more of those things. Whether it really truly is gas or not, the body's gonna kinda kick into high gear.
Yes, exactly. And then there's the real shifts that happen potentially when traveling.
Mhm.
If someone travels and they're gonna be sitting in the car for 8 hours with their family, let's say the family is not used to farting in the car with each other. Well, now the person is holding their gas the whole time. Of course,
Mhm.
they're gonna be experiencing cramping and discomfort
Yep.
if that's happening, and then there's no movement or very little movement.
Mhm.
So, and how's the eating habits during travel? Often
Yep.
they're not the most optimal. So there's each of these things too that can be impacting just normal functioning. And then let's say the gas does show up or the stomach cramp or the constipation shows up as a result of specific behaviors. It's easy for the mind to attribute it. Oh no, my IBS symptoms are coming back. Oh no, it's going to get worse again.
Yeah. Oh, yeah, you're so right. Yeah, everybody farts, everyone. So we all fart.
It's like, are
I know
you
you don't wanna
human?
let one
You
loose
fart.
in front of people that might be noisy, but the reality is forcing gas to stay in the body by trying to, quell it is not really helpful, depending on how much your body everybody produces gas, right? That's fermentation done by your bacteria, that's part of the process. More or less gas is often described or defined by what we eat and what our microbes are doing. One of the things that I always thought was very fascinating, and of course, we're just barely scratching the surface, is how much communication our microbes in our body, whether they're bacteria or archaea or viruses or all those other things, how much they talk back to the brain too, right? We're
Mhm.
starting to understand that they produce things like neurotransmitters and break down things. And I think that's the next frontier, of real healthcare is understanding how to maybe improve or change the microbiome to improve our health.
Yeah, there's so much fascinating science, even, just starting really to get to launch. I love reading about it, love learning about it, and still feel like I'm totally ignorant around what's going on because there's so much happening in the microbiome.
Yeah.
But I do know enough of it to kind of evaluate that anytime someone is having a physical distress, I encourage them to evaluate what's happening in their gut, not only with the psychological or gut-brain connection, but their
Mhm.
microbiome, because that's where it seems like a lot of our health is generated from: the immune system, the communication, the gut lining even being related to gut functioning, but also
Mhm.
mental health and just so much there.
Ladies, if you're noticing more fine lines and wrinkles, it's not just about aging, it's about the loss of estrogen. And that affects our skin structure, making it drier, thinner, less firm. But here's the great news: I've created Biased Mastery Cream to help. This luxurious bioidentical estrogen cream supports your natural hydration and elasticity. It's packed with nourishing oils like olive, jojoba, aloe, and coconut, so it feels amazing and helps soften those lines and bring back that healthy glow. I've been using it, and let me tell you, my skin has never looked or felt better. It's smoother, more radiant, and those little cracks and creases are way less noticeable. If you're ready to give your skin some extra love, check out Buy Est Mastery on the Metabolic Blueprint website. And that's metabolicblueprint.com/, Buy Est Mastery. That's BIEST Mastery, Mastery. And your face will thank you. Yeah, yeah, it's interesting because we do our clinicians in our clinic and also online, we do a lot of GI testing, right? We do a lot of gut microbiome testing, and as somebody who studied it, we understand of about, I would say, about 30% of what's really going on in there at this point. Now, we understood almost nothing 3 decades ago, right? So, like, 20 years ago, your gastroenterologist that went through med school 20 years ago doesn't really know much about what's really going on in there other than the mechanics, right? Unless they keep
Yeah.
up on the science. But now that we can identify them, we can identify the microbes. And I think the interesting thing now is we can identify a microbial balance, right? And identify if it's what we would call dysbiotic, like not a helpful, like I like to think of it as a jungle. And we have a
Mhm.
lot of squirrels and, let's say, snakes and spiders that have grown. So we can identify if we have an out of balance, but we can't really identify what's truly healthy because there's so much variability. And particularly Americans have a lot less, like our jungle is missing entire species groups compared to other countries with less Western influence. Um, but I think what's even more fascinating to me is we've identified that some of these microbes like make GABA, for instance, which is our body's kind of neurotransmitter that's sort of like Xanax, and they also break it down. Right. So I think there's a lot of shifting in the microbial balance that might possibly increase this sort of triggering of that visceral hypersensitivity or just an inability to turn off some of those messages. But we're just not there yet.
Yeah. It's so much to be learned, and I think even though we, as you're saying, only know 30% of it, it's enough for us to start to influence our behaviors and the way we're living. We don't need to know it all yet, but we do need to be able to recognize that, okay, intellectually it's there. So how do I translate that to like daily emotions and behaviors, choices?
Right. Right. Exactly. Yeah. I think the only way we know is we have to start using that clinical research and start really kind of pushing the envelope and getting human experience to add to that data for sure. So tell me, obviously you get a lot of people that have probably been through a ton of treatments for IBS, right? Multiple antibiotic rounds, herbal rounds, motility activators, and things like that. Tell me what would they experience if they started looking into this? Because I do think, as somebody we've been working with this for a long time. We have psychology in our office, but I think there's a huge part that people are missing that you have to address the nervous system and this sort of impact. What what can people anticipate and expect from that experience?
Well, I think they start to experience the answer to the missing piece. That's the most common theme that we'll see is patients will come in, I've tried this, that, and the other, usually A through G, there's a variety, and maybe each of those have been different rounds at different times in life. But even in their most optimal moments where they had, let's say, 70% relief from their GI distress, still missing that other 30%. And too often they're given a message of just like, well, that's just the way it's going to be, that it's time to adapt. This is part of life now. And so when they come to treatment with us, they get a different messaging. They get one of empowerment, self efficacy, the belief in oneself to do something helpful. And they learn the skills to be able to make those changes. So, in our treatments, we facilitate the interventions in the session, but we oftentimes will audio record the experiential activities they do because repetition helps. So that we want them to be able to take these exercises and start applying them to their life, you know, throughout the session or throughout in between the sessions. And so I think, you know, it varies. Sometimes patients by the 4th session are mind blown by the improvement they see. Now, 4 sessions, complete remission, that's not the norm, but it does happen where you see things that are just so hard to believe. More often, patients are, in our treatment course for around 12 sessions, and they'll start to notice that they're no longer avoiding the food. They've been working with their dietitian maybe in collaboration with us. They're not avoiding the foods or scared of the foods they once were. They're no longer spending an hour or 2 in the bathroom while at work. They're, not lying in bed holding their stomach. There's, oftentimes there's the extreme cases. Obviously, there's the less severe cases, but with all of them, they're feeling this sense of like, wow, I really have the power in my mind to start to shift this dysfunctional communication that's developed. It's kind of hard to believe that our brain is that powerful, and yet they experience it and they tell us this is so fascinating.
Yeah. Yeah, well, I think it's we get so compartmentalized in medicine. We've got your cardiovascular system, your respiratory system, and we sort of look at the digestive system separate, but we have the enteric nervous system, which is that kind of bigger brain that's actually wrapped around
Mhm.
and controlling the gut. And I think once people realize that those 2 are intimately tied together and that they have some, ability to influence it, I think it's a really great thing. So it sounds like you give tools so people might experience some cognitive behavior therapy sessions, and do you put them under hypnosis while they're working with you in the room, or do you do it
Yes.
virtually also?
Yeah, the great point. It is all of our services are through telehealth. So we started off, in person in Virginia. But with COVID, we decided to launch that telehealth department a bit
Mhm.
sooner, and now that's our only modality. Just it works so well with our patients and then allows anyone in the nation to access us. So,
Yeah.
and thankfully, the researchers jumped right on it to make sure that clinical hypnosis was just as effective through telehealth as it is in person. So, there's trade-offs, but it's just as effective, which is super important. So yeah, they're gonna experience, cognitive behavioral, the cognitions, the behavioral changes, the skill development, and then we teach them I actually say that I teach all my patients self-hypnosis because I think it's important that they know this is actually a skill that they are going to be able to use long after they've seen me, and all of our clinicians use that as approach as well. So we facilitate a hypnotic experience in session and then we break it down and make sure they know what we're doing and how we just done it, so that later, let's say, um, I don't know, I don't wanna pick something too extreme like fear of dogs, they might need help, with the therapist with that one. But let's say they're preparing for a presentation at work, they can use the same self-hypnosis they learned with us and apply it to the anxiety of that presentation. So it's very generalizable once they've learned the skill.
Yeah, I think that's really valuable, because no matter who the person is, they're going to experience some anxiety, some stress, some things in their lives that in life that's going to make, whatever a new challenge, and the fact that you learn tools to be able to apply them all the time.
Yeah,
Is great. Which you mentioned earlier on, like hot flashes and things like that. Let's talk a little bit about that because,
sure.
obviously there's extraordinary hormone changes that are happening in perimenopause and menopause, and some women go on hormone replacement, and obviously I'm an advocate for bioidentical hormone replacement, but other women may choose not to, and some women, even with appropriate replacement, might still get some hot flashes and night sweats, right? So
Yeah.
let's talk about the mechanism, like where do those come from and how does hypnosis potentially help that, right? I can tell the biochemistry side that how hypnosis can actually do that.
Well, and Dr. Gary Elkins from Baylor has been a pioneer with this, and so he's actually launched an app called, Evia, EVIA, which uses hypnosis for hot flashes, and I don't imagine that's the only one, but it's one that I'm aware of, and he's just so reputable, where we a patient can learn how to physically shift the experienced temperature, but it's not just the experienced one, they can actually regulate the autonomic nervous system, thereby impacting the experience of the hot flashes. It's not a super emphasized area for me, so to talk, like, deeper about it, I would just be guessing, to be honest, but I've read enough of his published work and in the hypnosis protocols to know, like, it works, and that's impressive to me.
Yeah, because it's the same nervous system, right? It's the same,
Exactly.
sort of subconscious control that you're not aware of. So if because the truth is if you look at like hot flash research, yes, hot flashes get worse when you're under stress. So the person that's, anticipating a flight maybe the next morning is probably going to have more hot flashes and night sweats than they would on a regular day just because they're not sort of amped up and keyed up and stressed already, right?
Yeah,
And so being able to use those same tools to control a hot flash or, night sweats would be obviously very, very beneficial.
yeah, and, another one that blows my mind is that we can influence constipation or even loose stools with hypnosis.
Yeah, so let's talk about that because 'cause I'm sure people are like, "What?
I
What are you
know.
talking about?"
Yeah, it's fascinating, and we still don't understand all the layers in which this is happening, right? There's
Mhm.
just so much going on in the systems, the individual systems, as well as the way that they're communicating that we don't know how. There's, numerous different theories that are, out there, and, uh, Dr. Louis Demy has great neuropsych material on understanding what's happening in the brain with MRIs, and a lot of good stuff there. I totally just lost my train of thought.
I took a menopausal moment, damn it. Yeah, we were talking about kind of the being able to actually manipulate your bowel
Thank
consistency and
you.
experience. Yeah. Yeah, sorry, we were
Yeah,
talking about a menopausal moment before we got on here, like, we're gonna probably have a menopausal moment somewhere on tape.
it may happen.
It's okay.
Yes. So, with the bowel movement, with the bowel influence, what can happen? For example, with constipation, hypnosis can influence the muscle tissue to loosen and soften, to relax, essentially, right? So that's one way in which constipation can be aided. Even guided imagery. There's some cool so guided imagery is its own separate intervention, but there's a lot of overlap with hypnosis as well, and hypnotic experiences often will use some imagery. And so, for example, in patients I've had with constipation, I'd hate to ruin it for any of your listeners and give them an imagery and they're like, "No, I don't want that." But imagine something where you pull a nozzle, right, and something
Uh-huh.
soft and smooth comes out of it,
Yeah,
right?
like soft serve ice cream, there we go.
Okay, you can do it to your listeners.
Yeah, I can do it for listeners, so yeah,
Yes,
yeah.
exactly. So even having individuals relaxed on the toilet, calm their body, go into hypnotic state, and then imagined that, dispenser releasing it
Mhm.
can influence a bowel movement. Now, how that is actually happening, we don't know, but it definitely can. Or for instance, on the other side of it with loose stool, so individuals experiencing diarrhea through, several different hypnotic experiences, we can teach them to see their GI tract as a little bit of an assembly belt. And
Mhm.
it's turned up into a higher gear. Imagine being in a factory and there's the production of material. There's this exact pace in which it's optimal. If things slow down, that's not good. If things speed up, that can be havoc, right? And so we can help the patient imagine and train their body and access that subconscious to hit the reset button, to unlock the nozzle and get it back to the tempo that it's supposed to be at.
Yeah. And those are 2 really good visuals, actually. You know, what it made me think of is Lucille Ball when they're in that assembly line and, and all of a sudden it speeds up and they're shoving the candy in their mouth. Probably not the
Yeah.
right visual, but still, all of a sudden things are falling off and they're having to just
Yes.
yeah, it's a mess, right? So,
The
you know
body wants to help itself. The body is wired to heal, to help, to regulate. And so our job is just to figure out, okay, how do we remind the body? How do we kind of nudge it or reset it? And hypnosis is one of the most effective ways to do that.
Yeah, and I think the big take home message here is obviously if somebody's got digestive stuff, particularly that they've been messing with for a long time, whether it's IBS or, whatever it may be, SIBO, that there is a neurological slash gut brain connection slash subconscious part of that that needs to probably be addressed along with it. That it's not just about the physicality of those systems together and then the microbes within it, but there's an entire other piece. And that chances are if they were to integrate this on top of the treatments they are doing, they get a lot
Yes.
better.
Pull your
Because
dream team together, right? Have the various experts all working on their layer of the puzzle.
yeah, I mean, I can just say this from my research, obviously, because I had to go through the entire history of IBS.
Mm,
And, really when you start looking at, the literature, the visceral hypersensitivity is really where the literature sat. It was seen as a sort of psychological slash subconscious problem more so than some of the other things we found more recently, like the bacterial changes and immune responses. But for the longest time, IBS was considered to be a gut brain problem, period,
yeah,
full stop. Right. And it's not that it's the only thing, but it is definitely a big component of it. And obviously cognitive behavior therapy is a piece of that, helping your body sort of walk through the right system changes and then using visualization and hypnosis to help sort of turn off that subconscious wiring, I think is so important.
yeah. And it emphasizes that you're right. It's these multiple experts coming together that it's unlikely that any one of these pieces is going to fully resolve a multi system disruption.
Right, right.
And so you can wait and try one at a time. And oftentimes when that's, the way that people experiment, they'll experience some relief, but not enough. But really, if anyone, is at the earlier stages of deciding what to do, if they can, it's pulling in each of the elements at the same time so they can magnify each other.
Yeah. Yeah, I hear that, over 20 years, I've heard that a lot. I'm looking for the thing, or I want to take this thing and then see if it works. And then if it doesn't, I'll take that. I'm like, okay, there's 6 things that we've identified already that are wrong, that are causing your symptoms. You can't do one at a time. Right? Because one at a time, it's not a silver bu if it was that easy, Western medicine would work, let's face it, because
Mm,
that's how Western medicine looks at everything is we're gonna find that one symptom and compare this one thing to it, and if it has any impact that's greater than what could be just by chance, we'll pretend that that's gonna fix everything, right? But the
yeah,
reality is it's multifactorial, and you have to hit it from multiple sides. You can't just, try a pill for an ill because there's too many parts, and I think we still get stuck in that mindset a lot, and then we suffer for a lot longer than we should,
for too long.
for
Yeah.
too long. Yeah, for way too long. So you have some resources that my listeners can go to for more information because 'cause I'm sure a lot of them have never heard of this. You've got a group, I believe, that, has, like, a skills workshop kinda thing. Tell my listeners
Yes.
about that.
Yeah. Well, and the whole mission of the organization is to increase awareness of this condition, of the treatments, and then increase access. So one of the ways we're increasing access is to provide a 4-week workshop, an introductory GI skills workshop, where if people will kind of want to become a little bit aware of what's going on, what is this? What are some introductory skills? That's an easy way to ease into it. For some people, they're not ready to commit to the individual treatment plan, the individual psychotherapy. And so this is a good one. And for anyone with IBD, we do anticipate later in the year of launching an 8-week IBD psychotherapy group as well.
Yeah, 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 IBD I think is a little more challenging.
Absolutely.
Yeah. A little more challenging just from what the, nervous system is kinda doing, for
Yeah.
sure, but I think that's really valuable, so that's tell them what website they can get to that from.
I recommend just go to the main page, gipsychology.com. They'll be able to look at our resources. We have some videos that explain what we do. And then we also offer a free 20-minute consultation over the phone where our care coordinators can explain what the treatments are, can listen to what the person's experiencing, and then talk about whether our treatments are a good fit. That's our goal. We're not just here to provide services. We want to make sure we're providing effective treatments. So if we're not the right fit, we're going to help them connect with someone else who's more appropriate.
Awesome. Well, Dr. Tiffany, this has been a great conversation, and I hope my listeners on Menopause Mastery have found a new set of tools, or at least a new understanding of how they might be able to address some of their own health issues, particularly digestive issues. Thank you for coming on.
I'm so happy to have been here. Thank you for having
Yes,
me.
wonderful. Wonderful. Thank you, everybody, for listening to Menopause Mastery, and I'll be back with you next week.